The health department had an ambitious plan to vaccinate all teachers during phase 2 rollout of COVID-19 vaccines. Health Minister Zweli Mkhize initially told the National Council of Provinces this would happen in April. It's now May, and not even all health workers have been vaccinated. In February, Basic Education Minister Angie Motshekga revealed 1,169 educators has passed away as a result of COVID-19 between December and February. In my interview with Satu just now, you heard the overall number is in the 3,000s. Why has South Africa not prioritized teachers and other workers who operate in public spaces with more exposure to risk than most? To discuss this, I'm joined by Kabelo Mahlobogwane, a teacher from Silverton Primary in Pretoria. Thank you for your time this afternoon. How are you feeling when you go to school every day? What's the situation in your classroom, Kabelo?
The situation is very bad. Teachers are getting sick every day, learners are getting sick. And actually what makes this worse is that there's no clear line of communication. In these cases, we don't know whether learners are, are not informed of learners that are testing positive. What actually happens is that these cases are hidden from us, and we only hear rumors, some we hear from parents. So we don't know whether it's an instruction from the department that we should not be told if learners are testing positive or not. But it's very bad. We're panicking. We know people, we see people that we know, people that we live with every day getting sick. And there's no PPE in schools. Last time we received PPE was last year. This year we never received any PPEs. It's very bad. Classes are not sanitized, not being cleaned every day. It's very bad. Learners are not social distancing. It's very bad. We panic every day. Going to school, it's like we don't know whether you're going to come back home safe or sick.
How many students do you have in your classroom, Kabelo, at the moment? Is there some level of rationalization of the number of pupils that you have to teach?
Well, there is something positive about going to work, is that we have now about 20 learners in my classroom from the 40 that I had before COVID-19. That makes the situation better in the classroom in terms of managing. But there's no way I can avoid interacting with the child, because I'm still expected to mark the learners' books. I'm still expected to make them write formal examinations, and I'm still expected to mark those formal examinations. So at least the classes are better. We panicked when we heard that Parliament has approved that learners must all come back in primary school. And I'm in a primary school now, so we don't know what's going to happen, but it's very bad.
Are you a member of a union, Kabelo?
Pardon?
Are you a member of a union, of a teachers' union?
Yes, I'm a member of a teachers' union.
Which one is it?
The Educators Union of South Africa.
And how are they helping you at this time of crisis? Do you feel they're doing their jobs to lobby really hard, both at Department of Education and the Department of Health, to make sure that you as teachers are prioritized?
Well, my union has done great. Actually, it's the only union that has spoken on this. And my union has said that until teachers are vaccinated, schools should close and we should go back to remote learning, because the situation is bad in the classroom. There's no PPE, there's nothing. And they've returned to the Department of Basic Education to try and persuade them to close schools up until the third wave is over, because we are going into winter now. Most teachers have exhausted their medical aids. A lot of teachers do not have money to go and visit doctors. There's no support. Actually, early last year when we reopened after COVID-19, we saw nurses that were coming to the school to talk to us. But we never even saw those nurses ever again. We don't know their contact details. You go to a clinic as a teacher and you are told that before you can even be tested, you have to be a contact first. That time you have all the symptoms. At that time, there's a learner that tested positive in another class that you teach. So we don't know what's happening. We see these learners coming to school in the morning in their taxis, full in these taxis, and actually not even wearing masks. Learners in my school are only scanned once they enter the classroom. And as a teacher, no matter how many times you try to complain to say, but which regulation is this? I tried to write to the district office in my professional capacity as a teacher. And I can tell you I'm still waiting for feedback now. It's almost 2 months to ask why are learners being scanned in the classroom instead of the gate when they come in. And I don't have a response now. So as a teacher, it's difficult to also ask these questions, because you are seen as a rebel and you are seen as someone that's trying to challenge the management. So it's a very tough situation.
You say that you may have to return to remote learning, but we know that that experiment that happened last year, that had to happen when everybody was pushed away and told not to come to school and many had to stay home, a lot of students didn't cope with that very well. What's your own experience in terms of how you work in a primary school when you have to work with students remotely in their homes?
Well, students with classes that have over 60 learners or 80 learners did not cope. I'm aware of that. And it's because now the rotation was very difficult because they had to be turned into 3 groups. But in schools whereby the numbers are smaller and learners were only divided into 2 groups, things worked much better. In my school, for example, this was the only opportunity that we had in my 5 years of teaching that we saw parents being involved in the education of their own children. Previously, schools were like babysitting centers and parents were not even involved. But because of this new rotation system, parents were forced to do homework with their children at home. And what I saw that was an issue for some parents is that they were shocked now that they also have to contribute to the education of their children because they thought that was just the job of teachers. But in terms of education and academics, learners have improved a lot. I've actually gotten to know more of my learners in this time where I'm able to interact with them one-on-one. And actually, I have enough time to support each learner that's struggling academically. All of the other issues that I've been aware of, that have been highlighted to me, are issues that have to do with social development, but not basically education and academics. Learners have been doing very well. Actually, teachers have also been coping. Previously, I would know of teachers, my friends who went to psychiatric hospitals because of depression and stress. But in this year, I can tell you all of my friends were doing very well. They were happy. Everyone was in a joyous mood because of, we felt for some time the department is taking care of us. We knew, some of us, that it was a by-the-way issue. What is happening now is that we wish we could be vaccinated. Eventually, as you've announced, you've already said, we hope to be vaccinated in the 2nd phase. But now it seems like things are changing. And some of us are disappointed, but we're not shocked at all because we have never felt like government has prioritized teachers in this country.
That's a very, very important statement. Kabelo Mahlobogwane, a teacher from Silverton Primary in Pretoria, telling us that teachers do not feel they are a priority when it comes to being vaccinated during this COVID-19 pandemic.